Hi friends, my name is Meher and today we are sitting with Dr. Himanshu Gupta, who is an orthopedic surgeon specialist in minimal invasive spine treatment. He has an intervention of almost 4,500 plus cases, and he has treated nearly 1,800 plus patients in his 12 years of career as an orthopedic. So today we're going to talk about a couple of things about what are the top 5 common reasons for back pain with you. And we have a lot of people who have back pain. Back pain is the most common procedure or problem which is searched online, and we thought that this is the first time we should make sure that, since Dr. Himanshu Gupta is with us at UPHI, the Wellness and Surgical Center on the Golf Course Road today. So we would like Dr. Himanshu Gupta to let us know the top 5 reasons why people have back pain.
Good morning, everybody.
Yeah.
Thank you, Meher, for having me here on this topic. And it's the most common cause for which a patient visits the orthopedic OPD.
Yeah.
I mean, it's been realized in almost all countries. It's been the most common cause for the patients visiting the OPD.
Mm-hmm.
Almost 75% of the patients of the people around the world would have back pain at least once in their life. That's something which is again American study, it says.
Okay.
So when you talk about the most common 5 reasons why somebody would have a back pain, most of the reason in today's time, the most common reason is the improper posture. Long hours of sitting at work, when you are sitting for 8-hour, 10-hour days, you're working on the laptops, you're bent over or crouched over, wherein there's a lot of pressure which happens on the lower back. The second most common reason is that even with those 7-8 hours, if we are a little bit intelligent in terms of taking frequent breaks, we are not sitting consistently and we are adopting the good posture, but we are exercising to keep our back strong. That's where lack of exercise is the second most common.
Lack or incorrect.
I would say lack.
Lack of
exercises leads to back pain. Third reason would be, yes, it is familial. People tend to have a back pain tendency running in families where their parents, one of their parents, or either or both, if they have been having back pain, they are more predisposed to having this condition, and which is something which is there in about at least one of the siblings, if not all, if either of the parents is having a back pain or a neck pain issue.
So hereditary is one of the common reasons which fall.
Fourth reason would be if we have improper way of lifting things, putting things down. So that's where your reason of incorrect exercises comes in, wherein you have not balanced or made your back straight while you're lifting, because there's too much of peer pressure, so you need to sort of lift too much of weights
against the rest of the people.
Yes, and you have to do that in a short interval. That's where you end up having injured your back or having pulled out a disc or caused a pressure. And the fifth common cause is injury, not weight injury, but suppose an accident, fall, or you're driving a car, somebody bangs you from the backside. So that's where again you got a jerk in your lower back,
an incident.
Back pain. An incident.
Okay, fantastic. So that's the top 5 reasons what you have. So let me rephrase this for our audiences. The first one is incorrect postures. At anybody working for long hours having incorrect posture while they are in the long hours.
That is the start of what we call as a mechanical low back ache.
Mechanical lower back ache.
Yes.
Okay, fantastic. The other one is lack of exercise. Absolutely. If you are having a long hours of sitting but you're not exercising, strengthening your back, then obviously you're going to end up having a back pain.
That's
the third one is hereditary, and in your family if there is somebody who has a weak back, then it might just end up having
So that is one of the reasons which predisposes you to having a back pain if there is a family history of such
family history of fantastic. And the fourth one is the incorrect way of exercising. So if you're exercising not with the I would say the right guidance, then you end up having incident.
It does.
And the fifth one is, which is the most I would say
something which you cannot avoid, but that's something which is an accident or injury which has led to a back pain. Yes.
Okay, now tell us that one of the most important thing that everybody wants to know, or everybody has an apprehension, that's the reason they keep searching online, is that when should they go to meet a doctor, and first of all whom they should meet.
Okay, so again that's something which is a very important point, because most of the things in our country are still treated at home with home remedies, rest, applying balm, hot water fermentation. I would say it is not wrong what has
Okay.
been practiced over these
Yeah.
years, where you rest when you have a back pain, apply hot water fermentation,
Yeah.
apply some gel, rest
Yeah.
for a couple of days, and
Yeah.
see how things are. The severity
Okay.
of the back pain
Mhm.
and the longevity of the back pain
Okay.
should be a warning sign for you.
Okay.
Wherein if the back pain has been persisting for more than 4 to 5 days,
4 to 5 days. Okay.
and with the normal routine home remedies like rest, hot water
Mhm.
fermentation, and application of gels, or taking some simple pain medicines like a crocin pain relief or something is still not helping you,
Okay.
then you need to visit your orthopedic surgeon,
Orthopedic.
whoever is closest to you,
Okay.
or a spine specialist who would be able
Or
to
a
assist
spine
you.
specialist.
Yes. So that's
Okay.
one, if the duration is 4 to 5 days.
All right.
Second is you don't need to wait for 4 to 5 days if you are having
Incident.
incident associated with severe back pain
Okay.
with limited mobility. You
Okay.
are restricted to the bed itself. You're not able to get out of the bed. You're not able to do your daily
day-to-day.
chores. Yes,
Okay.
then you are absolutely in
the right
need of
meeting a
visiting a doctor and
Fantastic.
getting it sorted out.
Fantastic.
Okay.
All right. So,
Third would be if any of these back pains, which was a low grade back pain to start with. I mean, me and you both have had back pains.
Yeah.
Everybody has back pain.
Yeah.
But it usually is self-limiting. You tend to feel, yes, 2-3
Yeah,
days
it's
it's getting better.
Yeah.
But if this pain is consistently increasing in intensity, severity,
Okay.
or it is radiating, it has started to radiate now into the
Okay.
thighs, the legs, the foot, or you started to have any nerve symptoms like weakness in the leg, numbness, tingling.
Okay.
All of these are signs that you are having a neurological involvement.
Okay.
Again, in those cases, you're not waiting for 4 to 5 days or 1 week, 10 days, or thinking
Okay.
that this is a self-limiting disease, it will get
Okay.
better.
Mhm.
You need to visit your spine specialist or orthopedic surgeon rather than visiting a physiotherapist. The most
Okay.
common thing which happens in today's time is you have a back pain.
You
Instead
go
of
to
going to a doctor, you go to a
physiotherapist.
who usually start with physiotherapy. Yes, they do. But most of them are intelligent enough to tell you that these are the warning signs, you need to visit a doctor.
Yeah.
In some cases, the patients persist with the physiotherapist. No, I know this will
Okay.
get better. I mean, so that's where you should be listening to your therapist or your doctor.
Fantastic. So thanks a lot for that. So what Dr. Himanshu is explaining and has been implying to say at this moment is that in case if your pain is consistently happening for the next 4 to 5 days, and if you have these pains which are radiating, and if you have a tingling effect, and if your day-to-day chores are not being able to complete, you are not able to complete them, then you have to meet an orthopedic doctor. What he suggests is that nowadays you do have specialists in spine, when Dr. Himanshu Gupta is one of the spine specialists in Gurgaon, worked in hospitals like Fortis and Medanta, and his interventions have always been with spine. So the data which he has, of which he has taken care of almost 1800 patients plus only for spine. He does other cases too, very minimal of those cases, but only for spine he has taken care of at least 1800 plus patients, so which is a lot of patients. So in case if you have any sort of back pain, you should visit a spine specialist. All right, so this is one of the videos that we've done in regards with back pain. We're going to have series of more video. My name is Meher Patel. I'm the director at UPHI, the Wellness and Surgical Center on the Golf Course Road, and Dr. Himanshu Gupta is part of our team as a spine specialist at our center. So looking forward to see you for more videos. If you have any questions, you can put your questions down in the comments column below, and we're going to come back to you with answering those questions by Dr. Himanshu Gupta. So thanks a lot. Thank you, Doctor.
Thank you very much, man.
Thank you. Thank you.